You're watching CBS 12 News at 9 a.m.
It is National Immunization Awareness Month, and while there's been a lot of talk about the COVID vaccine, another vaccine is going a long way towards helping women battle cervical cancer. Joining us this morning to talk more about it, Dr. Thomas Morrissey. He's a gynecological oncologist and Promise Fund, a Florida partner, which helps provide women with equal access to quality health care. Doctor, thanks for being here.
Thank you for having me.
So a recent report shows an 84% decline in cervical cancer screenings in April of last year. How important is it for women to catch up with these screenings? And, you know, not good to hear that they're down on these screenings.
Right. I mean, with everything in the last year with the pandemic, you know, again, certain things have been put away. And obviously, for a period of time, we preferred people not going to their doctor to kind of stay home and isolate a little bit. But in terms of things, people are starting to get up to date on the screenings that they've missed. With Pap smear screenings, again, it's one of the most important ones. It's one of the most effective ones. And people who have had a Pap smear within the last 5 years, the chance of them getting cancer is almost zero. Whereas if you hadn't had a Pap smear in 5 years, then most of the patients who have cervical cancer nowadays are ones who haven't had their Pap smear for at least 5 years. So missing things for 1 year is not shouldn't make a huge difference. But obviously, we want people to get it back on their list of things they need to catch up on.
And another way women can stay protected is the HPV vaccine. So how effective is this, and what age should we expect to have this conversation with our doctor, you know, about possibly getting the HPV vaccine?
Right. So the HPV vaccine is one of the most effective vaccines that we have. It's been around since 2006. And it's been indicated and recommended really by the American Association of Pediatrics for 11 and 12-year-olds, both males and females. Again, it's something that is very, very effective at decreasing the risk of precancer of the cervix and also cervical cancer by 99+%. And so we're already seeing, you know, with the generation who's been receiving the vaccine since 2006, a significant decrease in the amount of cervical cancers, and the cancers that we find, we're catching them earlier. So it's a very, very effective vaccine. And the idea with any vaccine is to try to get people immune to the agent before they get exposed to it. So that's why it's recommended at kind of age 11 and 12. And we're seeing a huge decrease in the amount of people with Pap smear problems and cervical cancer due to that. It's a big success story.
Dr. Morrissey, we appreciate you being here. We're going to post this interview to our website, cbs12.com, also a link to Promise Fund, which could help women get access to quality health care. So we're going to post it all there so people can go and learn more. Thank you, Sarah, for being here. Thanks, Dr. Morrissey.
Right. Thank you. Promise Fund is a great outfit, and it's helping us a lot to get screening to people who need it.
All right. Thanks, Dr. Morrissey.